health reporter Haley Hernandez is here with us now. She's taking a closer look this morning at loneliness and the problem of drinking now in the Hispanic community related to loneliness. Haley?
Yeah, Owen, good morning. So loneliness is, we talk about it so much since the pandemic, but really it's been studied by psychologists for centuries. And relatively recently, it's been diagnosable. Researchers at the University of Houston are now taking a closer look into why the Hispanic community specifically experiences higher levels of loneliness compared to their white counterparts. And I'm here with lead researcher, Dr. Jaye Derrick from the University of Houston. Dr. Derrick, I know you're leading the research studying the potential development of new interventions to improve health. So tell us a little bit about this project, this research that you're doing.
Yes, well, we know that people from Hispanic and Latino backgrounds tend to have greater levels of loneliness than people of non-Hispanic white background. And one of our real purposes for this research is to understand why this might be the case. We are studying several different variables, including, for example, the cultural conflict, so the extent to which people may experience conflict between their heritage culture, their beliefs, values, norms for appropriate behavior, and the dominant, largely non-Hispanic white U.S. culture, and the values, norms, and behaviors for that culture. To the extent that they're in conflict, they may be more likely to make people feel lonely. And it's important to understand loneliness, not just for its own sake, but also because it contributes to health problems like hazardous alcohol use.
That's what I was going to ask, is do we know there's a direct link between alcohol and loneliness, or we just assume that's a driving factor in alcoholism?
This is a relatively newer area of study, so we do know that people often use alcohol to feel better about negative feelings, for example, stress or sadness. But only recently have people begun to look at drinking for loneliness. And one of the factors behind that, I believe, was the pandemic, when we saw increases in both loneliness and alcohol use.
And both issues that we're talking about are mental health issues, substance abuse and loneliness. And I know that, in the Hispanic culture, the stigma with mental health is still very much alive. Are you finding that maybe the aversion to finding help is also possibly what's driving this?
That is a good question, and we have not gotten that far with the research yet.
We plan to find out.
We do intend to look at that. We do hope to, we're setting up the study right now, and we're planning to start recruiting participants this fall.
Is the ultimate goal, though, to find interventions and find ways to, navigate loneliness and not let it lead to alcoholism or something like that?
Yes, absolutely. So first, one of the things we're hoping to find is how to relieve loneliness and prevent it in the first place. And second is, if people do feel lonely, are there other more healthy methods of coping with it?
Any idea what you might find?
Well, we are interested in, as I was saying, cultural conflict. We also think that there may be, even alcohol use can be not beneficial, but not harmful relatively less harmful at lower levels. And we do know that people who drink for social reasons tend to have fewer problems than people who drink alone to cope with negative emotions.
And you say relatively, lower implications compared to drug abuse? Is that what you're
compared to drug abuse or heavier alcohol use.
Got it. Okay. What are the challenges with this study?
Well, as you said, people of Hispanic and Latino background are less willing to seek help for mental health.
Or to admit that they have mental health issue.
Yes, that is correct. And so that is one issue that we're worried may be the case, but we're not, when we advertise for participants, we're not going to be saying specifically that we're looking for loneliness. We're going to be talking about alcohol use, and hopefully that will help at least bring, and not necessarily problematic alcohol use. So hopefully that will help bring in people who drink, but a variety of people who may or may not be experiencing mental health problems.
Then you can dive deeper into it, recognize that the alcohol abuse is coming from loneliness, from a mental health
issue. Exactly.
Yeah, and I will just put it out there that there should be no stigma with mental health. I know in the Hispanic culture it is still, a very tense, touchy subject, but there should never be any hesitancy to seek help.
I absolutely agree.
All right, well, Dr. Derrick, thank you so much for joining me this morning. I appreciate it, and I can't wait to find out the results of your study.
Thank you.